safety, the client is able to move through their experiences and complete the stress cycle. Through a variety of modalities tailored to the needs of the client, we're able to effectively shift out pain, process trauma, and create a sense of calm and even joy. My name is Jamie Stern. I am a marriage and family therapist. I have a background in research and neuroscience. I specialize in healing trauma and also working through transgenerational trauma. I'm also a functional nutrition counselor, and I like to support clients on issues related to the effects of stress on the gut-brain axis. So I like to focus on health and well-being with the clients while they are moving through very stressful moments in their lives. Being able to maintain our physical well-being is really, really critical to our mental well-being. It's an area that I like to work with clients in. So in working with trauma, anxiety and depression tend to be very prevalent things that come up. So we tend to work through coping skills as well as being able to process the emotion out. For me, when I see anxiety expressing itself or depression expressing itself, I look at that as a reading that the body is giving. The body's sending us a message. It is either telling us that we're very, very concerned about something, we're very worried about something, and that's us in our hyper aroused state. If we're seeing depression pop up, then that tends to tell me that the person is in a hypoarousal state and they're feeling a lot. They are feeling dragged down by what they're moving through. Their state of depression is a reading that their environment is making them very, very happy, and it's sucking their energy out of them. So I tend to take both of them very, very seriously. They're important, they matter, and I like to use a variety of tools to address both of those things. And sometimes they are happening concurrently, which can be very confusing for the person going through it, because they'll feel themselves swinging back and forth through anxiety and through depression, and they'll feel a heightened level of concern, awareness, hypervigilance, and then they'll find themselves feeling very, very low, and suddenly things don't matter. And so that oscillation, I like to work with clients on that whenever it presents itself as well. So in regarding self-healing, it's definitely one of those things that happens regularly. It's not a one-time event. We can do healing things for ourselves, but it's something that really is best when we have maintenance for it. So offering ourselves a lot of healing opportunities, healing tools, healing modalities that we learn from our therapists, offering ourselves happy, safe environments so that we can actually sit in that healing space with ourselves. And that may be one of the most important things, sitting with ourselves comfortably. I personally define self-healing as a process of showing up for yourself, showing up with love and compassion. To me, it's being a best friend to yourself. It's validating your feelings, giving yourself space to process pain, allowing yourself to know that you don't have to pretend to feel good. And all of that promotes an internal environment of self-acceptance, self-appreciation, and even motivation to make healthy changes as needed. So as far as applications of self-healing that I like to offer myself, I give myself a very consistent routine in the morning. I love starting off my mornings with time for myself. So I will get back into my body. I'll do exercise first thing. When I wake up in the morning, I like to keep myself enrolled in a Pilates class. I used to not take myself somewhere to do that exercise. And I discovered that I really needed to be around other people when doing that. And I really appreciate the instruction, the guidance from a Pilates instructor. So I gave that to myself. I used to do it on my own. I actually used to teach Pilates once upon a time. So I had a little bit of shame coming through for myself, because I thought, no, I should be able to motivate myself. I should be able to do this. And I tried, and it was just difficult to maintain. So I put myself in an environment where it allowed me to be consistent and accountable for my own exercise. And so I'll get that in almost every morning during the week. And it feels really, really, really good. And then it sets me up to also make sure that I offer myself a healthy breakfast with enough protein to power me through the day. And that's really, really been instrumental. The nutrition and the exercise absolutely supports being able to apply these different tools for self-healing more effectively, because our chemistry balance in our own body is better off because of it. So for me, that is definitely something that's been very, very helpful. And then I'm able to apply my healing modalities, such as holding space for myself, breathing, having healthy lung capacity really, really enhances the ability to self-soothe when you're trying to do breath work. So all of it is related, and one thing helps the other thing. So I do like to do breath work with myself. I enjoy the nutritional component, like I said. I find the necessity in the exercise to be critical. And then sometimes I'll journal a little bit if I have time in the morning. I like to lay out my day for myself, and it allows me to be organized. It allows me to know what's coming up next, which means I am minimizing stressful surprises for myself as best as I can. Stressful surprises are always going to pop up for anybody and everybody at some point in time, but this gives me consistency, and that consistency has been incredibly healing for myself. My goal is to provide a nurturing and compassionate environment so that safety for the nervous system can be experienced. With safety, the client is able to move through their experiences and complete the stress cycle. Through a variety of modalities tailored to the needs of the client, we're able to effectively shift out pain, process trauma, and create a sense of calm and even joy. The modalities that clients can come to expect when working with me are very often body-based. I think that the somatic component, bringing in somatic work, is crucial to facilitate that mind-body connection. And then when we're connected to our bodies, a variety of other modalities can be applied. So we're able to do very effective trauma processing whenever we're in that safe space. Our nervous system is feeling safe enough to process effectively. So the modalities that I use for trauma processing or trauma reprocessing is brain spotting, and a modality called TRM, trauma resiliency model. I borrow aspects of somatic experiencing. I also borrow a few resourcing components from EMDR. And overall, it's body-based to make sure that the nervous system's feeling good. And then in that space, I love to bring in more of the CBT, perhaps a little DBT if necessary. And when a person is sitting in that space and they're not feeling like they have to keep anything under wraps, they don't have to conceal anything, they don't have to filter through layers of self-judgment, they're just able to be, they're able to be present with themselves. All of the modalities coming through tend to work that much better. So establishing nervous system calming is probably my priority. And then from there, we tailor it specifically to the client's needs. What modalities are going to help them the most? For some people, they really, really need to be able to talk and express themselves. They need to articulate what they've been moving through. They may even need to describe the sensations that have been flowing through their body, which again really validates and enforces the body-brain connection. So that's one aspect. Sometimes we'll flow right into brain spotting as needed if trauma is acutely presenting itself and just wanting so badly to be held and focused on so that it has an opportunity to heal. So generally that tends to be what the journey looks like, and we make it through. And I've had a lot of really wonderful moments with clients where after a period of time, it might be a handful of months, it might be a year or two later, but we'll have that great conversation where they're describing that they feel that they're ready. They're ready to take either a pause from therapy because they're feeling really, really good, or they're just ready to go off and apply these tools to their life. And if they ever need to come back, they know where to find me. So the way trauma ties into family work, so working with the family unit, the family system that's in place, or extending to marriage couple counseling, um, both of those areas have an incredible way of showing where our traumas are still existing in us or still taking a hold of our body, our physical responses, our emotional responses. And we find that when we are in relation with other people, that's when our trauma tends to come out the most. This can be very startling for people. This happens to people who have gone to therapy too. You know, they might have already done their work and they're aware of where they needed to do their healing, and maybe they've done it. And yet, when they enter into, let's say, a new relationship, or they enter into marriage, or they enter into family life, maybe they've had children, and all of these things are starting to come back up for them. A lot of people question, oh my gosh, did I not do a good enough job? And what's wrong with me? That sort of thing. And there's nothing wrong with them. What's happening is that as their life is changing, they have new things coming into their world that are shining a light basically on where there's still maybe some need or room for healing to be done. A perfect example of that would be parents who are in maybe full swing in parenthood, or maybe they're entering into parenthood, and they're seeing how they show up for their child. Maybe they have done a ton of healing already on themselves, and they're watching themselves in real time, showing up for their children, showing up for their babies. And sometimes it can bring with it some sadness. I'll never forget one client who was describing how her experience with her kiddo was wonderful, and yet there was this sadness in her that she was trying to release because it was related to how her mother didn't show up for her the way she's showing up for her child. And she asked, how could my mom not do that for me? I don't want to do anything else but show up for my kiddo. And so it really opened up the understanding that there was still some pain in there for her. And that's absolutely fine. That was something that we worked through and were able to release through the different modalities. With her, it was mostly somatic work, just being able to breathe again, and know that she herself is discontinuing what was sometimes what we describe as a generational curse. For her, this was not moving on to her little one's experience, and she was very, very proud of herself for that. In the marriage setting, marriage counseling, when we are in close proximity with our partner, so much can show up, so much dysregulation can show up. All of our pains and hurts from childhood that maybe were not resolved tend to show up. And it is so startling for people. And it makes them wonder, oh my goodness, is this not my person? Am I not the person for them? It makes people question if they're with their soulmate. I mean, it can be really, really devastating for people when they see complications showing up in their marriage. But so often, all that's being triggered or antagonized are those old wounds. And if they're just given an opportunity to be heard and held and loved on, really, sometimes with our partner or sometimes through the therapist, it really allows the person to see themselves with more clarity, understand where it's coming from, and then through that, they're able to offer themselves a chance to pause and decide how they want to react rather than just feeling their poor nervous system hijacked and, having some explosive reaction that they don't actually mean to be having, but it's just so very painful and it's reminding their body of perhaps past experiences, past frustrations that never had a chance to fully release. So that's how I see trauma pop up in the family setting, in the marriage setting, and there are a multitude of types of expressions. Those are just a few, but they can be very, very detrimental to the family, to the marriage. Trauma specifically can be very detrimental to the family or to the marriage. And that's why we really, really we're at our best when we offer ourselves that self-healing and space to really get to know ourselves and love on ourselves. Yeah, actually love ourselves. For me, if I were to pick 3 words, concepts towards self-healing, the first, it's actually an order of operations for me. The first is validate our experience. I feel that self-healing requires us to validate our experience. And then number 2, offer ourselves compassion. And that can be very hard to find. Sometimes we need to do inner child work to find that compassion. Sometimes we need to do trauma processing to find that compassion. But once we find that, we must offer it to ourselves. And that's a funny one because a lot of people freely give compassion to other individuals, but they never give it to themselves. They're the ones that they don't, let off the hook. They're the ones that they hold to incredibly, almost inhuman high standards. So yes, once we find that compassion, then we can add a pathway forward for ourselves through encouragement. So I feel that the most important aspects of self-healing is to validate our experience, offer ourselves compassion, and then offer ourselves a pathway forward. When you engage in self-healing, it has an incredible ripple effect. It helps to stop those generational curses. It really helps stop effectively transgenerational trauma. It promotes good internal health and wellness. It enhances connections and relationships. It makes the hard challenges of life a little bit more manageable. And it allows you to have a fantastic relationship with yourself. And I think that that's possibly one of the most important ones. Our relationships with other people, they're so important, but our most important one, our primary one, is the relationship that we have with ourselves.